to lose my mind. You've been gone for so long, I'm running out of time. I need a doctor, call me a doctor. I need a doctor to bring me back to life.
Does someone just say, I need a doctor? Oh well, the doctor is in.
I cross the void beyond the mind, the empty space that circles time. I see where others stumble blind to seek a truth they never find. Eternal wisdom is my guide. I am the doctor.
Oh yes, I am a doctor, and the doctor is in. And when the doctor is in, you know that you have absolutely nothing to worry about when it comes to your health and to the well-being. Good morning and welcome to this great episode and edition of the program Doc Talk, your number one online health program where we get to talk about everything and anything that has to do with your health and to the well-being. And it is me, Vicky Lonia, right here on yours truly, solely for your listening pleasure, Vicky Lonia Radio. Okay, so today on Doc Talk, what exactly are we going to be looking at? The last edition of Doc Talk, we looked at the second part of amnesia. In total, we looked at amnesia, where we looked at the meaning, the symptoms, the types, the causes, the diagnosis, and the treatment of amnesia, right? And it was a fantastic topic because the audience rating was quite high. So today on Doc Talk, we are going to be looking at another health condition that whether or not you're going through it, you should be aware of it, you should know about it, you should tell others about it, so that the world will be aware about it and, go through the prevention processes. And those who are going through it will know exactly what they are going through and they could, get treatment and all that, right? Great. So, today on Doc Talk, do I go ahead and bring the action?
Bring the action.
Okay, so because you're ready, then I am ready. So before I continue, I would like us to know that this episode of the program is sponsored by Lucky Star Pharmacy. Yes, Lucky Star Pharmacy is situated in Benin City, Nigeria. So for those of you, my great listeners who are in Benin City, or those of you who are going to Benin City, I don't know, whatever it is you're doing, but if you happen to be in Benin City, Lucky Star Pharmacy is the best drug dispensing store you really need to go to when you need the best of pharmaceutical advice and drug dispensation and all that. Okay, Lucky Star Pharmacy is situated at Plymouth Road, close to Bob Iswa Junction. Yes, Plymouth Road, just off Bob Iswa Junction, Benin City. Okay, the address is right there at the description of this show. Okay, so Lucky Star Pharmacy is the best place to go to when you need the best of pharmaceutical consultations, medical consultations, when you need a pharmacist to really attend to you, for the best of drug dispensation, and customer care service is absolutely great. So they are the official sponsors of this edition of the program Doc Talk. Right, so today on Doc Talk, we are going to be looking at this health condition called hyponatremia. Yes, hyponatremia. 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 It is a broad topic actually, and I am afraid that we might not be able to look at everything today. Okay, but if we do, good. If we don't, no problem, no rush. If we don't finish it today, we'll finish it tomorrow. Okay, because I really want you to understand everything there is to know about hyponatremia. All right. So, hyponatremia is actually a condition that occurs when the level of sodium in your blood is abnormally low. Sodium is actually an electrolyte and it helps to regulate the amount of water that is in and around your cells. Okay. Now, in hyponatremia, one or more factors ranging from an underlying medical condition to drinking too much water during endurance sports causes the sodium in your body to become diluted. When this happens, your body's water levels rise and your cells begin to swell. This swelling can cause many health problems, from mild to life-threatening problems that could really lead to the death of the patient. Okay, so hyponatremia treatment is aimed at resolving this underlying condition. Depending on the cause of hyponatremia, you may simply need to cut back on how much you drink. Okay. In other cases of hyponatremia, you may need intravenous fluids and medications. But just bear in mind that hyponatremia is a condition that occurs when the level of sodium in your blood is really, really, really low. And sodium is actually an electrolyte that helps to regulate the amount of water that is in and around your cells. So now that we know what hyponatremia is all about, how about we get to know what the symptoms of hyponatremia are? So what are the symptoms of hyponatremia? Hyponatremia signs and symptoms may, include lots of stuff like nausea and vomiting, headache, confusion, loss of energy and fatigue, restlessness and irritability, muscle weakness, spasms or cramps, seizures and coma. Okay, these are the symptoms of hyponatremia. So when do you have to see a doctor? If you have a medical condition that increases your risk of hyponatremia, or if you notice these symptoms, okay, or you have other risk factors for hyponatremia, such as participating in high intensity activities, and you have the signs and symptoms of low blood sodium, see your doctor immediately. Especially if you are an athlete, if you are a sportsman or sportswoman, you stand a high risk of having hyponatremia. Okay, make sure that you see your doctor at all times, to go through the test and all that. Now, what are the causes of hyponatremia? Sodium plays a key role in your body. Okay, you have to understand that. It helps maintain normal blood pressure, it supports the work of your nerves and muscles, and regulates your body fluid balance. Okay, so a normal sodium level is between 135 and 145 milliequivalents per liter of sodium. Hyponatremia occurs when the sodium in your body in your blood falls below 135 milliequivalents per liter. So many possible conditions and lifestyle factors can lead to hyponatremia, including certain health conditions such as some water pills like diuretics, antidepressants, many pain medications can cause you to urinate or perspire more than normal. Okay, and another lifestyle and condition that could lead to hyponatremia is heart, kidney, and liver problems. Congestive heart failure and certain diseases affecting the kidney or liver can cause fluids to accumulate in your body, which dilutes the sodium in your body, lowering the overall level. And then, we have syndrome of inappropriate antidiuretic hormone, which is the SIADH. Now, in this condition, high levels of the antidiuretic hormone, ADH, are produced, causing your body to retain water instead of excreting it normally in your urine. Okay. Also, another thing that could lead to hyponatremia is chronic severe vomiting or diarrhea. This causes your body to lose fluids and electrolytes such as sodium. Also, drinking too much water, because you lose sodium through sweat. Drinking too much water during endurance activities like sports, like marathons and triathlons, can dilute the sodium content of your blood. Drinking too much water at times can also cause low sodium. When they say too much of everything is bad. Alright, dehydration. Taking in too little fluid can also be a problem. If you get dehydrated, your body loses fluids and electrolytes like sodium. And then hormonal changes too. Adrenal gland insufficiency, Addison's disease, affects your adrenal gland's ability to produce hormones that help maintain your body's balance of sodium, potassium, and water. Now, low levels of thyroid hormone can also cause a low blood sodium level. And also, recreational drug ecstasy. This amphetamine increases the use of amphetamine increases the risk of severe and even fatal cases of hyponatremia. Okay, so those are the causes of hyponatremia. Now, we are going to go straight to the risk factors of hyponatremia. Okay, stay with me, don't lose it. All right, now, the following, we're going to be looking at factors that may increase your risk of hyponatremia, and they are as follows. Age. Age is number one. Older adults may have more contributing factors for hyponatremia, including age-related changes, taking certain medications, and a greater likelihood of, developing a chronic disease that alters the body's sodium balance. Okay? Another risk factor is certain drugs. Medications that increase your risk of hyponatremia include thiazide diuretics, as well as some antidepressant and pain medications. That is, in addition, the recreational drug ecstasy can be linked to fatal cases of hyponatremia. And then another risk factor is conditions that decrease your body's water excretion. Medical conditions that may increase your risk of hyponatremia include kidney disease, syndrome of inappropriate antidiuretic hormone, and heart failure, and a lot of other things could really stand as risk factors. And then intensive physical activities. People who drink too much water after taking part in marathons and ultramarathons and triathlons they all stand the risk of having hyponatremia. Okay, so what are the complications of hyponatremia? The complications of hyponatremia. Now, in chronic hyponatremia, sodium levels drop gradually over 48 hours or longer, and symptoms and complications are typically more moderate. So, in acute hyponatremia, sodium levels drop rapidly, resulting in potentially dangerous effects such as rapid brain swelling, which can result in coma and death. Premenopausal women appear to be at a great risk of hyponatremia-related brain damage. This may be related to effects of women's sexual hormones on the body's ability to balance sodium levels. Now, are there prevention measures for hyponatremia? Yes, treat associated conditions, get treatment for conditions that contribute to hyponatremia, such as adrenal gland insufficiency, and then also educate yourself. If you have a medical condition that increases your risk of hyponatremia, or you take diuretic medications, be aware of the signs and symptoms of low blood sodium and visit your doctor always. Another thing is take precautions during high-intensity activities. Athletes should drink only as much fluid as they lose due to sweating during a race. Thirst is generally a good guide to how much water or other fluids you need. Another thing is consider drinking sports beverages during demanding activities. It mustn't be only water. There are other sport beverages that you can take. And then drink water in moderation. Okay, drinking water is vital for your health, so make sure you drink enough fluids, but don't overdo it, please. Thirst and the color of your urine are usually the best indications of how much water you need. If you're not thirsty and your urine is pale and yellow, you are likely getting enough water. Okay, great. So now that we know all that, how about diagnosis of hyponatremia? How does your doctor begin to, diagnose it? Your doctor will start asking you questions about your medical history and doing a physical examination. Besides, signs and symptoms that we have listed earlier should also help in the diagnosis. Treatment of hyponatremia. Okay, treatment of hyponatremia, like I said before. Okay, I haven't said that before, have I? All right. Just make sure that you visit your doctor always. Your doctor knows what to do when hyponatremia has been diagnosed. Okay. We are still on the program. It is still Doc Talk right here on Vikilonia Radio. So, do not get me wrong. Do not get me wrong. Hyponatremia is really, really a dangerous medical health condition, and you really need to be aware of it. Okay. So, treatment includes intravenous fluids and medications. Like I said, visit your doctor at all times. Okay. What can you do? Make sure that you list all your symptoms. Make sure you visit your doctor at all times, and he would help diagnose if it is hyponatremia you have or not. Great. So do not forget that this episode of the program is sponsored by Lucky Star Pharmacy at Plymouth Road, Babizwa, off Babizwa Junction, Benin City, Edo State, Nigeria. And do not forget that this is Doc Talk, and when it comes to your health and total well-being, well, that is what we do right here. Alright, that's all I've got for you right here on Vikilonia Radio, and do stay tuned to Vikilonia Radio because more programs will be coming up right here for you. Have a great and lovely Tuesday.